Well, you've come to the place where it is the webinar for ADHD in women. So if this is the place that you wanted to be, then you are in the right spot. My name's Tom. I'm a co-founder of Boss of the Brain, and more people are coming in here. And the other co-founder of Boss of the Brain is Dr. Claire Sira. And so this webinar today is, Dr. Claire does a lot of this stuff. She's sort of her own renowned authority in ADHD. And, she spent her career trying to understand all the unique challenges faced by women with ADHD. And so this is going to be a presentation that is about women, for women, by women, except for me. Once I get off and do my introduction, then we'll get you over to Claire. And sorry, just adding more people here. And like throughout her career, I mean, she's been tirelessly trying to help women, with all the obstacles that stand in their way. And today she's just here to share her expertise with you guys. And so what we'll do is we'll do, a bit of a presentation. So she's prepared some good information and she'll share her slides with you. And then right after that, we'll do a bit of a Q&A. And so just for the beginning part here, if you have any questions, feel free to add them in the chat. So we have Grace also here trying to help monitor and do all that. So if you ask a question, Grace will see it. If other people like that question, definitely do the click of the little add the reaction with a thumbs up or any one of the reactions, because then if that question gets a lot, we'll make sure that we ask Claire that at the end, okay? And other than that, feel free to just comment and chat with everybody in the chat. And I think now we could probably just get started, don't you think? I think I got everything.
All right.
Yeah.
Well, thank you. Welcome, everybody. I'm so thrilled to see so many people here. And I see a lot of familiar names, people who I've met through my practice or in the Boss community. So I really appreciate you coming. Thank you for that. I'm excited to get started. So maybe I will, I have to turn, I always turn my own picture off because I find it distracting, but I had to turn it on because I'm going to spotlight myself. And then I'm going to share my screen. All right. Hopefully everyone can see that. Yep. Okay, good. So one of the things we know about ADHD in women, particularly if the diagnosis came late, is that they mask their symptoms. So in the chat, maybe you could just put a yes if this is something that you identify with, because I do hear this a lot, that more than I hear from men, is that women with ADHD actually they invest a lot of energy into how other people perceive them, and not out of vanity, but because they are concerned that how ADHD manifests in them would not be acceptable, sort of generally. And girls learn this at an early age. So whether or not we are diagnosed in childhood or as a teenager, they learn quite quickly to cover up ADHD symptoms because ADHD makes them feel different. And they learn pretty quickly that other girls don't act the way they do. And they unfortunately interpret that as being evidence that there's something wrong with them. Kids and teenagers do not want to be different. You'll see them, they dress and they think they're so unique and they all look exactly the same. They don't want to be different. And so ADHD creates a sense of being different that is unwelcome. And whether or not you were aware of this being an issue for you in childhood, as adults, if you learn to mask, you will continue to do so. You will continue to feel ashamed of these differences that you perceive in yourself, and you'll wear a mask all day. So people maybe in your lives don't know this about you, or that's not obvious to them, and they often kind of think you have it all together. The wheels can come off when you get home, though, because that's usually when the mask comes off because we feel safe, or we're simply too tired to keep wearing it. There. If you do wear a mask all day, you've actually caused yourself a second problem, though, because if you are good at masking, like I am, you have a new problem. people will believe the mask. They will believe the lie that you do have it all together. They won't see the chaos at home. They won't know that you feel like you're drowning, that you think you're a slob, that you believe that you're less than other women who seem to manage working full-time, raising a family, and doing all the things that you are struggling with. They won't know all of that. So as Tom said, I'm Dr. Claire Sira, and I won't belabor that because he gave me a lovely introduction, but I have been working in this field for quite a while, and I've decided several years ago to be more open about my own diagnosis of ADHD, which came late in life, because, well, for a few reasons. I think it helps me in this work. I have the insider's perspective, but I also think it's important not to stigmatize myself by keeping it a secret. So that's why I share it. And so in the chat, I'm always interested to see, who, and I will look briefly, but it's too distracting for me to watch the chat, but I'm interested to see. So if you were diagnosed late, if you could say that just from a proportional perspective, and I will look later at the chat just to see what's happening for people. I mean, I hope it's changing as we identify ADHD in girls more, but I fear that maybe we're not. I know this is a lot of detail, and I will go through it in more detail in a moment, but I found this in an article that looked at ADHD across the lifespan. And what I liked about it, these are not specific ADHD symptoms. What they are signals to someone like me or a physician, somebody who's interacting with the child, teen, adult, that could point to the need for an ADHD assessment. And so if you look at this slide, I've circled frequent detentions. So the ones I've circled, some of them I have experienced. So who was in detention a lot, in elementary school? I was. So if you were, that might be a signal that you might have had ADHD. Who had problems with relationships. So most kids, when they're becoming teenagers, fight with their parents. That's the norm. But I think ADHD adds a level of complexity to that transition, and it was distinctly unpleasant for me. There was a lot of conflict in my family when I was 14, 15, 16. And so if that was going on for you, it might be a signal. As you get older, you'll have increased likelihood of internalizing conditions. So that's at the bottom here: depression, anxiety, stuff that is sort of inside, invisible sometimes to others, but absolutely more common in people who have a diagnosis of ADHD, whether or not they know it. They might have problems with parenting. They might find parenting extremely difficult compared to their peers, and they might feel ashamed about that. It says here contact with social services, but certainly it doesn't have to be that extreme. It can just be a sense of inadequacy as a parent, which naturally is not going to improve your mood. Over down on the right, where it says fibromyalgia and chronic fatigue syndrome, these are not symptoms of ADHD, but there is some evidence that in women, if those diagnoses have already been made, it is worth looking for ADHD as well, because they can also co-occur. This is something that I feel quite strongly about. ADHD is a diagnosis that is made when a certain constellation of symptoms are present and they're causing impairment. It's not a superpower, it is a problem. But ADHD is the problem. You are not the problem that needs to be solved. What needs to be solved is the way ADHD is interfering with your life. And I can't stress that enough. This is near and dear to my heart because that's where I am. Some of the challenges I think that are unique to women are the expectations that women should act a certain way that are not necessarily placed on men. And men have their own challenges. They have their own expectations on how they are expected to behave. But this talk isn't about them, it's about women. And so when we think about expectations on women, this is part of the issue, I think, for girls and teens and women when they don't feel like they match those expectations. These are the kind of thoughts you might be having about yourself. You're not as feminine as other women. And what I mean by that, it could be that, you're just not quite as graceful, maybe as you think other women are. You might be a bit of a klutz or a bit clumsy like me. You might blurt things out because you have a hard time inhibiting your speech. like me, so there may be things about you that don't feel as feminine. And certainly a lot of us identify as being tomboys as girls, which I don't understand that phrase tomboy, and I suspect it's not positive, but anyway, that's what I was called. And it was true, I was one. I'm too much, so loud talking, loud laughing, too much for other people. I can't do the simple things I should be able to do. Like everybody else seems to be able to manage everyday life. I don't know why I can't manage. And the last one breaks my heart. When people say this to me, it just makes me so sad to hear it, that they have this sense that they're being held back. But the thing is, ADHD, it's a lifelong condition. There's no cure. It just has to be managed. But if we never either get a diagnosis or have a good understanding of what that is for us, we can't accept and acknowledge that this is something that needs to be solved versus where the problem needs to be solved, and we can't move forward. So this acknowledgement, I think, is needed as, yep, this is the problem, I'm going to name it, which can bring some relief, can bring some grief, lots of other feelings, but then at least it allows us to move forward. Again, this is sort of where I'm at. So selfishly, I want to talk about this because this is really important. When we think about perimenopause and menopause, there is significant overlap in the clinical presentation of women who are going through this transition and the underlying brain mechanisms that are responsible for the problems in ADHD. So the frontal striatal cortex, prefrontal cortex. For some women, their ADHD symptoms worsen for 10 days or so during the luteal phase. So if you're still menstruating, this is the second half of the cycle before you bleed. And so when progesterone is high, estrogen is low during this part of your phase, your stimulant medications, if you're taking them, will not work as well. You will be much more symptomatic, whether you take medication or not. And so all I can suggest, and I didn't always do this, but to cut back on caffeine and sugar in that week or two, and exercise as much as you can, because your body is not feeling as good generally. And so some of these habits, I think that we can manage them when we're not in that part of our cycle, but we need all the help we can get when we're in that part of the cycle. Some women take a low-dose antidepressant or anti-anxiety medication just 1 or 2 days before they begin to menstruate. And that actually can help with the emotional dysregulation that is in addition to anything you might be experiencing as part of ADHD. And by the way, women who don't have ADHD also do this because it can be helpful. So they're not on an antidepressant all the time. It's just for those few days. Some people find that increasing their ADHD medication slightly helps a few days before. It might help them feel like they're in a bit more control. That was not my experience, but everybody's different. And so I encourage you to experiment with yourself just to see if you can use these tools to better effect. Interestingly, oral contraceptives can improve ADHD symptoms in many women because it minimizes the hormonal fluctuations. And so you take 3 weeks of estrogen only, and then you have 1 week of progesterone only. So these are interesting findings that are coming out now of ways that our hormonal changes really influence the symptom presentation. But I think the part that is, I think, most relevant is that as you move into menopause, women who have ADHD, so they are managing their ADHD symptoms and their brain is different because they have ADHD. It's what's causing the symptoms. We have less cognitive reserve. So the cognitive problems that are accompanying menopause I think they're more apparent because we have less room to manage them. We're not starting from the same place. So functionally, our symptoms might be even worse than they would have been if we didn't have ADHD. And there is some evidence that the executive functioning problems after perimenopause, so once you're through it, they might partially recover to what you were like before menopause, but that's only if your sleep is improved, your anxiety is improved, and your depression is under control. And so your thinking will be highly affected by sleep and mood and anxiety. So keep those in mind as well, because I think, again, they are extra burdens for someone who has an ADHD diagnosis. All right, so taking a look at these very critical symptoms that are perimenopause and menopausal symptoms. I mean, what do they remind you of? I mean, look at this list. It's quite familiar to me. ADHD symptoms are in red. So this is the same list. And the only one that isn't a pure ADHD symptom is depression, which is also a symptom of menopause. So if you are approaching this part of your life, be prepared and just know that there are things you can do with respect to hormone treatments, your own medications, if you're already taking it for ADHD, but also be aware that it's a ride and I didn't enjoy it. I'm glad I'm almost through it. It's really quite challenging. You know, the mood changes were dramatic for me. I don't mean to be too depressing, but one of the things I hear, and again, worry, is that because ADHD as this added burden, as you try to meet the demands of society, and women, we're often expected to be the organizational hub for a family. We're the ones that are meant to remember the birthdays and sending the Christmas cards and getting to the party. And it just seems that often falls to women, not always, but often. And so in that process, especially if you were raising young children or still are, where are your dreams? And if you have piles of laundry everywhere, are they under that? Like, where are your dreams? And I want to make sure that they don't get lost for too many months and years, because then you might forget where they were. You have challenges. If you have ADHD, you have challenges. But those are not reasons to be treated without respect. They're not reasons to socially isolate and hide and mask your symptoms because you're fearing connection with others will show those things that you don't want to see. You get to explore your ideas, you get to ask for help, and you get to pursue your dreams. That might sound selfish, especially if you grew up in a household where women had the expectations on them that were very family-oriented and not so much self-oriented. But again, I encourage you to keep those things in mind, because you only get one life, and I don't want you to run out of time before you focus on some of these things that are going to make your life the best life you can make it. I would imagine most of the people on this call either have a diagnosis of ADHD or strongly suspect they do, or there's people in their lives that they love that have this diagnosis. You are absolutely not alone. And that's one of the reasons I'm doing this is to help connect women with other women who might be feeling the same things and have that sense of solidarity, but also share a little bit about the kind of things that are out there for you. So I'll hand it back to Tom